we can't give it feedback and it can't change and make a difference. If you start a new chat tomorrow, it will forget everything that you talked about. That's a little bit dangerous if that feedback doesn't reach the ears of the person producing it.
All right, welcome back to another segment of my conversation with Dr. Jason FauntLeRoy. Jason is a naturopathic physician specializing in endocrinology and diabetes. He's based in Seattle and is the founder of FauntLeRoy Naturopathic Medicine. Let's dive into another part of the conversation with Dr. FauntLeRoy. I want to transition to a completely different topic.
Yay.
Because I think this is something that, and I haven't talked on my show about this at all, so this is kind of new territory for me. I've gotten into a lot of naturopathic medicine, I've gotten into psychedelic medicine, but I haven't talked about the social aspect of medicine. I love to make fun of insurance companies. I love to make fun of the conventional medical system and the VA. But the unfunny thing about those medical systems is there are people who are left behind. And in particular, I want to talk about the LGBTQ plus community. If I've missed some letters, I apologize. It's not something that I keep close tabs on. But I want to talk about, my producer's giving me a thumbs up. I love it. I want to talk about the folks that are being left out of healthcare and how, as alternative providers, can we support the groups that need care? So let's just open the floor there. Opening thoughts, go.
I think there's stigma, and it comes from fear. People have had bad experiences where they've been lectured about their lifestyle. You know, when I came in about my nerve pain, what does my lifestyle have to do with my nerve pain? And, you know, these things seem completely unrelated, and they really lose trust in the medical system as a whole, that this doctor is going to lecture them about their personal life or something along the risky behaviors that they're doing based on their sexual practices, for example, right? And so people then take a step back and say, I don't know if that's a safe place for me, right? Or the other side of it, where there's just assumptions made, right? Like that we're all doing things the same way, and that then therefore when we test someone for chlamydia, we don't even necessarily ask who their partner is, which changes the site that we might test them for chlamydia, right? Like it and you might miss it and leave somebody with active chlamydia if you don't ask the right question, because you're not really very open to the idea that people have different ways of living. And this is where it gets tricky, is because then as naturopaths, we get so much of this in that, you know, you and I might probably see a huge load of this. And I feel like I've become really articulate in the language of speaking to people who have this unique perspective, making them feel safe, making them feel like this is a space that your info is not going to be shared. You're not going to have, right? Like I honor your choices, I'm not going to push mine on you. So that's a great place to start, I think.
Perhaps part of the conversation is, are conventional medical providers even comfortable having these conversations? Like, because if you're going to go have a conversation about chlamydia, you're going to have to ask some questions that are really personal.
Yeah.
If you're not comfortable with it as a provider, asking, are you having oral sex? That's going to change the appointment.
I think many are. And I think that, you know, like I've gone myself to great MDs, so it's not a knock. But I think the training that we received was this really generous place where I was surrounded by people like yourself who made me feel safe and like there was a place that we could talk about those things. And so it became ingrained in the way that we developed as physicians. And I feel good when I refer someone to a naturopath who has alternative feelings, lifestyles, whatever that is. I know that they'll be well taken care of. So MDs can do a good job, but I don't always know. Sometimes I'm just trying to get a referral based on their insurance company, and that's really negating the idea that they might go to someone who's an absolute bigot. And that's happened, and that makes me feel horrid for that person, because then the damage can be done where people have very serious long-term PTSD towards the medical community.
And that right there is a huge barrier to getting care. I mean, never mind other things like, gender affirming care or appropriate STD testing, but just having somebody do annual labs on you. Like that leaves a huge gap in healthcare if somebody can't even go to the doctor's office and feel seen as a human being. One of the things that I loved most about my time as a resident with you at the clinic that we worked at in Ballard was the different, like so many different types of people walking into our office, because as far as I know, it's still an insurance-based business, but insurance-based business that saw everything from Regents and Primera, which are kind of the top of the stack, down to AppleCare, Molina, United Health, which is kind of the bottom of the stack. And then you take into account the fact that Seattle is truly an international city with the tech business that's there. And oh my God, the number of different types of, and the variety of people that walked into our office was simply amazing.
Mm-hmm. It was fun. I had a lot of doctors who were coming into our office, right? They felt like we gave them the time and the education. So it wasn't just, or we could kind of fly by and just say, hey, any cardiovascular symptoms? And I don't need to explain what a palpitation to them is, right? Versus then
Yeah.
the next day, seeing, people who had English as a second language, or even people who are of the deaf community. So you're having a translator, right? Like there was so much. I loved the experience of doing that. And it's really important then as a provider to make sure that you're honoring who that person is in front of you. And I think that's what we do so well. That's what I love doing, is making people feel safe in my care. That's the goal, right? Because then
Yeah.
you get the real story from them, right? Like all of a sudden they just suddenly open up and tell you, oh yeah, I've got all these things that I've been never feel safe to talk about, right? And that is where the real magic can happen, because we finally understand why they're coming in.
Yeah. Well, it was because I grew up in a very white conservative Midwest background without, and I was in the Navy, and you see lots of things in the Navy, but at the time I was in the Navy, up until 2012 at least, it was very cis hetero. And there was no deviating from that norm at all. I didn't even come out of the closet until I was 40, which is pretty amazing. I only started my medical education a couple of years after that. So I feel like in a lot of ways, working in an urban area like Seattle is really an expansive way to learn how to sit with people and not be judgmental, which is half the battle.
Absolutely. That lack of judgment. It's not about me as the doctor. It's about the person in front of you, and that you're there to support and to be a service to them. And that can mean a lot of different things. And it can mean for the same patient a very different thing from Monday to Tuesday, right? Like, I'm here as a diabetes specialist, but sometimes my entire visits are spent on mental health, because that, if you don't take your insulin, it doesn't really matter how good our treatment plan is for your diabetes. That mental health side of it, or the LGBT side of it, right? Like feeling heard and seen, that comes up and it needs to be addressed appropriately. And I want people to be able to feel safe always in that space with me. And that's the goal overall.
Well, that's great for Seattle or Portland or San
Yes,
Diego.
yes.
You see where I'm going with this,
Yes.
LA. What about places like Bozeman, Montana, or Spokane, Washington, that
Yes.
are less open to this sort of thing? And I ask because you're from Montana, and we talked about this recently about where some of these areas are going. Like, how does somebody who doesn't fit the mold still get adequate health care in places that are not welcoming?
There's some great resources that I've slowly discovered over time, right? Like where you can go to various websites and they will direct you to LGBT friendly physicians. There's several of them that we can provide. It's a great starting point, right? And then being okay saying, like that person was fine, but I'm looking for something else. There's nothing wrong with saying I need a second opinion too, right? I've seen people come out of visits where they were treated very, very, very poorly, and the damage that it does is significant. And then they finally find that right person, right? And there are people in Montana. You just got to do a little bit of searching. And I'm opening my practice to doing telemedicine in Montana right now, just for this exact reason, so that people have someone that they can go to that they really know and respect, and know that it's going to be very professional and they're going to be able to ask those questions, right? And so once you get on that list of kind of one of these providers that provides this alternative care or safe space care, I think that all of a sudden you find out there are a lot of people in Montana who need this care, and that your doors just, there's barely enough time in the day to see everybody because it's in high demand. And I challenge the rest of my medical community to listen to that and say, you're missing something here. There's people that are in desperate need who want this care, and they are, if they'll pay good money, they really want to be able to be seen and heard and respected as humans. And I think that the trans care is really the biggest topic out there right now. And it's I mean, there's even legislation that's proposed at this moment would make it illegal for a physician to provide trans care to someone like, in some of these southern states, et cetera. And you could be in prison for 5 years as a physician for providing that care. At least that's the proposed law, right? Like, it's not about me. It's about the person that's here with me. And I want to make sure that they know that I'm here for them and what they need, not pushing my personal agenda.
Yeah. Well, I would say it's none of my fucking business. Like, that's how I approach it. Like, I don't do gender affirming care. I don't, and the reason I don't is because I have a DEA addendum on my license where I can prescribe testosterone, but I don't know enough about it, and it has to be done by somebody who's really competent and knows how to do that well. But you know what? The good thing about working with people like you and me is, like, we have a network. Like, if you need care and I can't provide it to you, I can find somebody who will work with you and give you really good care.
That network, that's the gold right there, right? Is all the people that you and I have great relationships with, and we can refer with confidence.
Yeah. Well, there's so much about that topic we can unpack, but there was one more social thing that we talked about briefly, and that was AI.
Yeah,
What a fascinating topic. Going back to Eric
absolutely.
Aronell the other day, Eric made a post on the naturopathic website or Facebook page about AI and how it's coming down the pike and how we should prepare ourselves for it. I think it was a really timely post. And more than anything, I loved looking at the comments and seeing how different physicians are using AI within their business to maximize efficiency. I'm curious, what are your thoughts on AI in our community and where it might be going?
Such a cool topic, right? Like, when it first came out, I was using it to edit my emails and come up with all these new ideas. I've slowly drifted away from it and used it less and less because, unfortunately, most AI is not doing a double check. It's not making sure, right? And as a physician, anything that I do, and I'm not using it to prescribe meds, but right, even just writing a paragraph for me, it makes mistakes. It omits the most important sentence because it doesn't understand the context. So I am slowly moving away from using it in any capacity. But the one place that I think that it has a use is summarizing research for me. As much as I enjoy research, every time I print something off to read before bed, I get like a page in and I fall asleep with it on my face, right? Like, I know there are people out there who love it. Just not me, right? Like, I like what it gives us is the data so that we can do things safely and have that research behind it. But it is hard. It's hard to keep up with it too, right? And so I love to be able to use some of these AI resources like Open Evidence to be able to help summarize the upcoming research so that it is easier for me to digest and I don't have to fall asleep on my homework, basically.
Yeah. As far as clinical applications, there's some platforms out there. Like Heidi is a platform for transcribing. I don't use those because I don't know where the information is going. And even though I don't think it requires, at least the way the law stands right now, to give somebody a separate consent form for approval of or consent for AI while you're having a visit. I just like I don't know where that's going. The way I use it in my particular practice is I use it to help summarize really complex chart notes. When I have a treatment section that it feels like it's 2 pages long, or you know what I'm saying. So it
Hmm.
helps me organize thoughts. But I, like you, I've done some research on things. Not
Hmm.
research. I have asked some questions on things, and I get back answers of like, "Yeah, that's wrong." And
Hmm.
then you give the thing feedback and it's still like, are you gaslighting me? Are you
Hmm.
telling me that, what's wrong isn't wrong? And anyway, so I find that particular part of AI, interesting, that I would provide feedback that in fact, here's you're wrong, and here's where it says you're wrong, and it persists in saying
It can't
something wrong.
change. We can't give it feedback, and it can't change and make a difference. If you start a new chat tomorrow, it will forget everything that you talked about, and that is not a human relationship. And that's a little bit dangerous if that feedback doesn't reach the ears of the person producing it. And so I think I get tricked. I talk to it like it's a person. It feels human. It uses human words sometimes better than I do. And so it's really easy to buy into what it says as being expert. And I get a lot of patients who come in having a lot of knowledge. And then when I ask where they got that knowledge from, they got it from an AI, which can be helpful. But then often there is these pieces, like you said, they're just flat out wrong. And that cannot happen in medicine, because if you make one decimal error on a prescription, that changes the dose from something therapeutic to lethal, right? We have to be precise, and AI does not have that ability. So it's really
Well,
hard to use it.
you made a great segue, because the other part that I see AI is patients coming in, and I say, why are you doing this thing? Well, AI told me. And I think it's good for generating ideas. Like, somebody says, I have these symptoms, like what could be going on with me?
Mm-hmm.
But when you start treating yourself based on AI protocols, I think that's a very dangerous place to go, especially because what we just talked about, it can be flat out wrong. The other piece of that is, Chat GPT doesn't know your body. It doesn't know your genetics. It doesn't know your health history. And even if you inserted all those things, would it still come up with an appropriate, treatment plan for whatever it is that you've got going on?
Sadly, no. I've tried it just to see, right? Like, asked it my own personal health history questions, and it comes up with, oh, you've got pancreatitis. I'm like, no, that's not it. I can tell you for sure, right? Like, I was just trying to ask it why I have always had in my lifetime stool that floats, right? Like, do I have some sort of underlying issue? But that's been lifelong. I'm pretty sure I haven't had lifelong pancreatitis, but that it was sure that that's what I had, right? It just isn't able to understand context, and that's dangerous for someone who doesn't know that it's giving information that could be in theory very, very dangerous. And so I get patients in a lot with those misconceptions, and sometimes that's half the visit, is just helping to dispel that and help them understand, actually that's the opposite of what you want to do. Please don't listen. Here's the data, and helping to fix that in the back end.
Well, the cool thing is they're sharing it with me. Like, when I go to a medical doctor, which I have to do every once in a while because my care is my insurance is TRICARE and it doesn't accept naturopaths. Like, I don't tell them what I'm doing.
Yep.
Why would I?
Yeah.
Because they're just going to judge me. Sometimes I do. If I get to know somebody, I'll be honest. But my patients are being honest with me, and that makes me feel really good. Like, they get this thing, they want to know my opinion, they respect what I have to say, and they're sharing the nitty gritty with where they're finding their information. And it opens up the door for a really honest conversation about how can I best support your healthcare with where you are right now.
Pat yourself on the back. Reaching that space with the patient is the whole goal. That's the idea, and that means that you're serving them incredibly well, right? There's nothing else that I think can serve them better than actually knowing what they really are taking. And when you get into it and find out what their supplement list is that they didn't tell their doctor, sometimes they're on 25 supplements, and that's important to know, right? So having that therapeutic relationship with them that's so honest is the dream. That's where you want one of your patients to be. So great job.
Well, thank you. Disclaimer, I don't know every medical doctor in America. Some
Yes,
of them
yes.
are doing wonderful work. I do know a couple here locally, and they're doing great work as well. I think the way our system is as a whole, with the insurance base, profit-based stuff, that's no way to do healthcare, and it's forcing people into a form of healthcare that does not serve the patient, it serves the insurance company. Okay.
You're absolutely right.
Well, we talked about a lot of stuff today. We've got a couple minutes left. With the time that we have left, I would love for people to know how they can find you, whether that be from Montana or Washington State, and if they want to work with you.
I would love to answer all of your questions. If you're the guy or the person that is really complicated and your doctor says, I don't know what to do with you, these are the patients that I love. So you can go to jasonnd.com. It has all my information. I have a place to email me, ask questions, blogs, etc., to kind of answer some of those basic questions. But I am in Seattle. I'm getting a space up in Linwood, so I'll be able to see patients in person here coming up soon. And then I do telemedicine for all throughout the state. So I love to see folks, especially I see her mostly in the rural areas where they're not able to get great care. So that's been a real boon, because sometimes you're an hour away from getting to a hospital who might be able to help you or something along those lines, and I kind of fill in the gaps between that. So that's I would love to have people just come and chat or send me messages if they enjoyed the talk.
Okay. Do you have a social media presence?
Very little. I'm like AI. I'm wary of social media, right? So
Okay.
it's there because I kind of feel like I have to, but I mean, I don't really use it. I don't check it very often. So
Fair enough. I I don't know why I feel called to say this all of a sudden, but in closing, if you have any questions about biochemistry, Jason's your guy. Like, I think I got a 40 on one of my first biochemistry exams, and I was a chemistry major in undergrad, for God's sake. And Jason probably got like a 98 on it. Anyway, you are one of the most intelligent people I've ever known.
I loved it. I could go to med school over again for fun. I don't
My
know what
gosh.
it is. I thrived. We got to be surrounded by such brilliant minds, right? I could be great at biochemistry, but I did not have the skills that you have in the manual therapies and all of that, right? Like we all pick our flavors and enjoy it. And I feel like I was taking a sip from a fire hose the whole time I was there, but it was a pleasure to be able to go to school with you. I learned so much, and it was such a blast to have that journey with you and continue it to this day.
Likewise. Yeah. I think my favorite part of my residency was getting to work with you and Lois. She came along later, but that's another conversation. But yeah, I hope at some point that we get you on as a guest again, because I'm sure that we can continue any of these conversations into a deeper level. So thanks for being on the show, Jason. I also do telemedicine, and I'm in person at Port Townsend. So if you want healthcare out here on the peninsula, www.meridianpassagewellness.com. I am on all the social medias. The Alternative Flight Plan has we have a TikTok now.
Wow.
What the fuck is that?
Wow.
Anyway, right? I'm on TikTok, and never thought that would happen. I'm on Instagram, Dr. Kristen Barnes. I'm easy to find, and the Alternative Flight Plan has a Facebook page and LinkedIn page. Anyway, if you can't find me, then you just haven't learned how to use Google yet. Anyway, if you liked what you heard, we ask you to please like, share, and subscribe, with share being the most important part. As always, if you know somebody that can benefit from hearing this message, please send them a link so they can listen in. As always, thanks for listening in on the Alternative Flight Plan. With that said, we're going to go ahead and enter the flight pattern, bring it back for an OK-3 wire in the aircraft carrier, and go eat a Barney Clark, which is not naturopathic food. For those that don't know, I've mentioned it before, Barney Clark is a double hamburger with a fried egg and cheese on top, and I think there's bacon also. So that's a Barney Clark. Anyway, thanks for listening in on the Alternative Flight Plan, and we look forward to seeing you next time.